Thanks for staying with us. Today is a World Sickle Cell Awareness Day. It is marked on the 19th of June every year and was established by the United Nations General Assembly in 2008 in order to increase awareness about the sickle cell disease and its cure among the public. Sickle cell anemia is a genetic red blood cell disorder, and the International Awareness Day is observed with a goal to increase public knowledge about the challenges experienced by patients, their families, and caregivers. The federal government has been advised to ensure legislature that will give priority to people living with sickle cell, especially in health centers in the country. Well, this comes as the world commemorates the World Sickle Cell Day to raise awareness on the issue affecting warriors. Speaking at a conference in Lagos to mark the day, the founder of the Sickle Cell Foundation, Professor Olu Akinyanju, noted that health facilities should be better equipped to be able to test children when they are born to detect those who have the sickle cell gene.
Test every child born to have that test so that every mother would know this child is AA or AC or AS or whatever, or SS. So you'll know from day one, yes, then it's easy to manage. Not when they just start falling ill and you don't know what, especially if they're living where there's not much information, or the people don't even understand or don't have any good doctors around, see?
Sickle Cell Foundation Nigeria has written formally to the Minister of Health and to the Commissioners of Health. And we're hoping that when they have the National Council of Health meeting, that's the meeting of the Ministers of Health and all the Commissioners of Health across the country, that it will also be brought and discussed. Because it's a painkiller. Unfortunately, in Nigeria, people just access medication across the counter, and that should not be. And Professor Akinyanju has been treating sickle cell for years. As I said, he's a grandfather of sickle cell. And what he's saying and preaching even to health caregivers and to doctors is that morphine should be given in hospital.
The importance of a day like this is to ensure that there is enough dissemination of information about the sickle cell disorder. It's the research that's going into it, the options for care and treatment, for patients and people suffering from, people who are afflicted with sickle cell disorder.